Question for team A. Sorry, rules. So if you get the question correct, plus 25. If you get it wrong, minus 25. If you don't know the answer, the question will be passed from A to B to C in the clockwise manner. And for past question also, the marking is plus 25 minus 25. So these are trivia rounds, and please focus on the hint that I will give. The hint will give you the answer directly. So starting with team A. And for the time keywords, the time is 45 seconds. 45 seconds start when I start reading the question. So, this scientist is said to be one of the most brilliant scientific minds we have ever had in the 20th century. However, at his death, something very unusual happened. The pathologist stole his brain and cut his brain into 240 pieces. This pathologist is said to have created 12 sets of 200 slides. The pathologist claimed that he is writing a story on his brain. So, identify the pathologist. And the hint for you is that he was a great physicist who was awarded Nobel Prize, but he was denied Nobel Prize for the most famous invention he has done. And the hint for the pathologist is that the first name of the pathologist is associated with a lymphoma that you study, and the last name of the pathologist is one of the brand. So team A, do you have an answer? First name of the pathologist is associated with the lymphoma. No? Pass to team B. Team B, do you have an answer? Team C. Team D, Team E, Team F. So the answer of this question is Thomas Harvey. The scientist is Einstein, the most brilliant mind of the 20th century. He was denied Nobel Prize for photoelectric. He was denied Nobel for relativity. He was given it for photoelectric effect. And the hint was lymphoma, Hodgkin's lymphoma, was discovered by Thomas Hodgkin. So Thomas and Harvey is a brand. So Thomas Harvey. So I told for a common cancer in females, and in USA this screening is done as soon as the first intercourse takes place. So what is this screening test? Absolutely correct. So plus 25 to team B. Pioneers of anatomical pathology. His early medical career, he was interested in embryology. He performed 30,000 necropsies. He was named by the father of modern pathology as Lining of Pathological Anatomy. He has made various descriptions about various things, but what is important that he is credited with the method of autopsy. So if you are a third year student, you know that there are some methods of autopsies. So who is this pathologist? And the hint I will be giving is there is something in ovary. There is a tumor, one of the tumors in ovary. We name it. There is some protuberance or something like that. Like dash protuberance of a tumor of blood. Team C has an answer. Team D. No, you block. Now you have to answer. Now you have to answer. Protuberance in a ovarian tumor. Dash protuberance of. What is the answer? No. So who is the pathologist? I want to answer for the pathologist. Huh? Correct. So plus 25 because even for a past question it is plus 25. So plus 25 to team C. Very good. Team C plus 25.
D.
Sorry, D. Sorry. Team D plus 25. So team D. This hematologist was born in 1868. He is the father of blood transfusion and father of blood grouping and immunohistochemistry. What is important is that he discovered a virus of negative marking also in this round.
Team F wants to answer.
No, but पहले तो E ला जाएगा ना. नहीं तसं please. If D does not have answer E नंतर F मग A. F नंतर C. A. T. Polio virus, correct? Fine.
I had an answer. But time when was it?
ठीक है we'll give it to team B.
But does team E also get? We said the answer.
So you both.
Both 20.
So D and E both gets 25. Again I am saying concentrate on the hint. Well-known and renowned pathologist called as Pope of Medicine by his colleagues. There is a triad syndrome and node named after him. I want you to focus on the word triad. This was one of the questions in one of the rounds. So who is this pathologist? Team.
13 has to answer.
E. First E will
How
answer.
much time do we have?
Time 30 seconds. तुम साथ खेलो ना. Very good. Plus 25 to T. E. Next. Yes, you can block like you are blocking. Statement about mobile phone E and D. So time starts now. He is a Hungarian physician and scientist of German descent and was famously described as savior of mothers because he reduced the incidence of postpartum infections which led to burden of maternal mortality. So he asked doctors to do something which all of us do every day. Block. See, understand the rules. Team F will answer. If F is not able to answer A, B, C, D, E. Team F. 10 seconds. Team F. No, not after that.
There is a sequence that will be followed.
Team A. Bacteria is a gram-negative bacteria having causation of GI diseases. The hint of this round is it was a prelims question. Who is the pathologist, Mr. Y? How much time remaining for team F? 15 seconds. Team A. Team B. Hint is, again I am saying, prelims question. Who is the pathologist? Y. Team C. Team D. Team E. So this is Helicobacter pylori. We discussed the clinician Barry Marshall and pathologist is Robin Warren. And the disease is peptic ulcer disease. So he is one of the most prominent pathologists of his time, pioneer in preventive medicine and British physician. He is known for discovery of blood malignancy, which is divided into 4 types. The hint is 4 types. Team E, how much time? 30 seconds.
The hint is 4 types.
4 types. Team F. Team A. Team B.
You want a hint?
From F.
C.
C. 4 types. And this blood malignancy which has 4 types. Who is this pathologist? Okay. Team D, question number 9. He was an American biochemist and geneticist who was born in 1927. He received a Nobel Prize in 1968 in physiology along with Indian scientist Hargobind Khurana. Interestingly, as a child, he developed rheumatic fever. What groundbreaking work is being referred here? And the hint is with Hargobind Khurana. He later on developed something called as home box genes. Team D. Team E. Team F. Team A. B. C. So the answer is the groundbreaking work is discovery of the genetic code. Biochemist is Marshall Nirenberg, who gave home box genes, which is written in first chapter of Robbins. Question number 10 to team C. He described something, and this something is a desert. So the last, so suppose the answer is cream potato. The potato word is the desert. He described enlargement of spleen in association with liver connected with a parasitic disease spread by mosquitoes. The disease I am talking about is spread by mosquitoes which bite in the evening. So, no, I am not asking the disease. What description am I talking about? So, what is that description in which the second word is a desert? Team C. Team D, Team E, Team F, Team A, Team B. So the answer is origin egg appearance. This is actually historical, but I found this question on the net, so I put it here. The pathologist is Richard Shannon. And next is 11th question to Team B. This is a sexually transmitted disease which is famously known as great imitator and mimicker. If you have read Apurva Shastri, microbiology, there is a history given to this disease. There was a poet named who was Block?
Team C and Team D.
Team C and D. So they have to answer. So he is also an Italian physician. What is the positive agent of the disease described? Correct. Treponema pallidum, the disease is syphilis. The person is Girolamo Fragasto. Okay, good. So plus 25 to Team B. 12th question to Team A. A diagnostic test used to distinguish a disease with otherwise indistinguishable symptoms like berylliosis. This test is named after a Norwegian pathologist who first reported the test in 1941. What is important is not what is written in the question. The hint is this is one of the differentials of TB presenting with non-caseating granulomas. So what is the disease? TB differential with non-caseating granuloma.
C and D.
Whose question? Team A.
A.
How much time?
No, but now we have got that answer.
Team B. Team B, Team C. They have to, now you have to answer. See, the rule was if you block the hint. See, you are not letting others know the hint. You are not letting others know the hint, so they are not able to answer. So now you have to answer. So if you don't answer, minus 25. Differential of TB and non-caseating granulomas. Correct. Answer is sarcoidosis. Plus 25 to Team C. Question number 13 goes to Team A. We are starting A to F. This is the last round. So this will get over now in 5 minutes. American physician, geneticist specializing in cancer genetics. He held a prestigious Guggenheim Fellowship from 1953 to 54. a disease, actually for a tumor, this hypothesis is there. So which hypothesis I am talking about? Team C has to answer.
Sorry, it's wrong.
No, what was the answer? No. Yes, but
Can you expand?
nonsense. What is the next? Okay. So plus 25 to team C, minus 25 to team A. Team B, question number 14. She is a British physician and pathologist credited with identifying a rare congenital disease, heart disease, graduated from University of Oxford. That is not important. The important is she identified one of the components of cartaginal syndrome. If you know, cartaginal syndrome is a triad of obviously three things. So what condition, what rare condition did she invent or discover? And the hint is, in this rare condition, there is, listen to this hint, you will get the answer immediately. There is distortion of side of distortion of side. For example, liver is in the right hypochondriac region. So, anybody wants to block or should I continue? D wants to block. So, if liver is in the right hypochondriac region, if it goes to the left hypochondriac region, that is the condition.
You have to read the question again.
Very simple. Right का left में हो रहा है. What is the condition?
Team B.
Block. Team B. Do you have an answer? Team C. Team D. Team D.
You have blocked it.
You have to answer, otherwise minus 25. नहीं ना? What did you answer?
It is a part.
नहीं, dextrocardia is wrong. Minus 25. Because in dextrocardia only the heart goes on the other side. Here all the organs or most of the organs go to the other side. Answer is situs inversus. Question number 15 to team C, and the most important question of today's entire quiz. We should be proud to be an Indian because he was the first Indian pathologist. So he was the first Indian pathologist. He described a father of pathology and medical research in India. He worked as professor of pathology in St. J.S. Medical College. He received Padma Bhushan in 1955. He has given the use of needle aspiration cytology for diagnosis of neoplasms. Now the hint is that he was closely associated with Tata Memorial Hospital, not a hint actually, but this is a factual question. Sorry for that. So team C, how much time? 10 seconds. Team C, do you have an answer? Team D, Team E, Team F, Team A, Team B. So the answer is Vasant Ramji Khanolkar. So Dr. B.R. Khanolkar was established in 1987 by Academy of Medical Sciences. He has written 3 books on cancer and leprosy in that time. So, and he is the first Indian pathologist. So we should be proud of him. Team D, last 3 questions of the entire quiz. So I think there is a competition between Team C and Team D. So buckle up. Team D, time starts now. He worked as a pathologist at the Boston City Hospital and professor of pathology at Harvard Medical School. Institute of Pathology named after him, awarded the Kober Medal in 1935. Now, he gave a body, like for example, I have given councilman body. There is one more body in pathology, and there are only 4 or 5 bodies in pathology. So, which body am I describing or referring to? The hint is this body. If someone wants to block immediately. The hint is this body is seen in diseases related to liver. Dash body in liver. Team D. There is negative marking. I am reminding you again. Huh? Correct. Answer is malleable body. Plus 25 to Team D. Very good answer. Second last question of this quiz. He was a French pathologist, physiologist, histologist discovered something related to nerves. So this is a physiology question actually. Something related to nerves. And he named some cells and discs which are named to his credit. His students are include notable pathologists like Darrier. Darrier is a dermatopathologist, and Raynaud. What did he discover related to nerves? And the hint is, please block if you want to quickly. The hint is, the thing that he discovered is described with solitary conduction. The question is to team. Team F.
But how does it go? Like this?
E, F, A, B, C, D, clockwise. A, team A. Team B. Correct. Plus 25 for team E. And the last question related to forensic medicine. He was an American pathologist. Team F. Time starts. He was an American pathologist and euthanasia proponent. His quote, "Dying is not a crime," is famous. He assisted 130 patients to die. He was convicted of murder in 1999. But what is important that he did something called as a first public assisted suicide. The hint, there is the surname of this pathologist is associated with a named sign after death. Post-mortem sign, if you are a third year student, no, but they are not actually, but there is a post-mortem sign.
Thanatology is the second.
Thanatology होता है second year में. Karmadhar sir is there behind. I've kept this question at the last for a reason. I know sir will come to the end of the quiz of presentation. So then the surname of this pathologist is named after named sign, post-mortem sign. Team E. Okay, I'll give one more hint. The name starts with the letter K. K. And I am asking who is this, so you have to get the name of the pathologist or whatever. Team D. Sorry, not team D. Team A. F के बाद ये team A. Team B. Team C. Team D. Team E. So the answer is Team C. Nobody blocked. They blocked now. They have to answer.
But they blocked after the measures. You cannot say it is not in the case. It was like it is more than you. And they say like
Okay. No negative marking for Team C. So the answer is Jack Kevorkian. Kevorkian sign. So this marks the end of the quiz. I request the scorekeepers
no
to.
tie between team B and team B.
Is that tie? Please reach it.
करायला पाहिजे होतं आपण.
So this is a tiebreaker question for Team C and Team D. What type of question do you want? I'll give you the choice. Do you want trivia, slide, clinical question? What do you want? Slide? Trivia. You decide.
We want best of two.
Okay, best of two you want?
Let's go best of two.
You want best of two, both of you? Okay, so the first question is this, diagnose. Team C. For tiebreaker questions, answer. So the hint is, this is a common viral infection, which is which is prevented by giving one vaccine less than 1 year. If you want to block, less than 1 year we give a vaccine against a viral infection.
Yes, it is in the national immunization.
Let Team C answer. Team C, do you have an answer? don't bother about negatives because if you get it, if you don't get it, they get it. They have got the correct answer.
Best of 2 again.
Okay, plus 25 minus 10.
But no, two now we said 2 questions. No.
So one question plus 25.
No, can we do best of 2?
हाँ best of 2 ही करना है.
Not marks.
Not marks. Best of 2 questions. I'll show you 2 questions. It doesn't matter. Sorry. Hepatitis. Wrong. Minus 10. I said no. ठीक है. No negative.
So
team D. Team D. Otherwise, we'll go to the next question. Hepatitis is wrong. Hint is that it is given as a vaccine under National Immunization Program less than 1 year of age.
Just less than 1 year. No.
आप पास से
Okay, so team D is not.
No.
हाँ.
Polio.
हाँ. Polio.
No.
So the answer is
Measles.
answer is measles. These are organ finger bodies. Now team D said they want trivia.
No, we didn't.
Team C said they want trivia. Okay, so trivia for team C. He was a German pathologist who is notable for his description of a rare disease, now known with a different name. He was also a politician, worked with the Nazi party, involved in violent conflicts, high-ranking military physician. He gave a disease. Now this disease is known with a different name. Hint is that this is a vasculitis. So which disease is being described here? Question is to what is the answer? Correct.
We had the same answer.
The answer is
But what you? We also gave the answer.
To do one thing, you go for rapid fire, 2 questions out of the 2 things. Instead of creating confusion.
so whoever answers first will get the.
Ask 2 new questions and go for rapid
We give
fire.
you both the same question. So whoever answers first.
First, we can. No time limit, no negative marking.
And if you want to decide winner, you will get 2 marks.
Okay. So rapid fire. Whoever answers first will get the. There is sir said there is negative marking. So plus 25 minus 10. Connect the dots.
We raised, she raised, we raised. I raised first. She raised
See, sir has made the decision.
Their hand was first.
Sir has made the decision. Team D has raised the hand first. So team D, please answer. Team D, answer.
Next, you have to answer.
Rapid
Rapid fire means the moment you raise your hand, you have to answer.
See, no, you raised the hand, you did not answer. Team C, she answered. I answered. Okay, correct. Plus 25. And now, question number 1. Again, it's a rapid fire. Please answer in a loud voice. We should be able to hear you. Whoever answers first is the winner. Plus 25 minus 10. A 47-year-old man has a dull constant pain in the midsection of right thigh